Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give very valuable comments. You can also visit the playlist. In the playlist, actually I have provided almost all the topics so far we have discussed in a very systematic order. So this is quite convenient for the continuous study if you want. Thank you very much. So today onwards we will see some of the Ayurveda approach of short stature. So far we have seen the basics of short stature in the contemporary medical science and also the clinical approach. So today onwards we will see what actually mentioned in terms of Ayurveda with regard to this short stature. In Ayurveda we actually didn't find any direct reference of short stature as a disease, but as we know that short stature is not a disease, rather is a clinical condition, isn't it? Short stature is not a disease. It can be seen in so many other disorders also, other clinical conditions, so which is seen in number of conditions. So short stature may be constitutional, may be genetic, and maybe also pathological. We know that, okay, or short stature may be also proportionate and disproportionate. So in Ayurveda, we find the words like Atihrisva. Okay, among the Ashtanindita Purushas, one of them is Atihrisva, that is too short. Okay, in the context of Ashtanindita Adhyaya, which is actually invariably pointing towards an endocrine cause of short stature. Okay, Ati Risva, Ati Durga, Ati Gaura, Ati Krishna. Okay, all these things actually different types of hypo and hyper conditions of endocrinal disorders. Okay, anyway, so due to the growth hormone or the pituitary gland insufficiency. So it is referred as Nindita because it is impossible for the treatment. It's quite incurable, so therefore it is told as Nindita. It is Nindita. Okay, so we find Hati in the context of Ashtanindita Adhyaya. Definitely this is nothing but Hati Hrisva. The height is less compared to the weight. That means weight is more but height is less. Hrisva. Okay, so that's clinically we know that is one of the short stature due to endocrinal conditions. It may be growth hormone deficiency, or it may be the hypothyroidism, or it may be some other conditions, adrenal problems. Anyway, this is endocrinal problem. Come to the next part. Similarly, we find one more word called as Vamana, and it is referred in the context of Janmabala Pravritta Vyadhi. Okay, Sushruta will explain in the Janmabala Pravritta Vyadhi, Vamana Adi Pravrittaya. So like that he explains. Okay, it is referred as Janmabala Pravritta Vyadhi. So this is due to Janmabala Pravritta. Therefore, this is quite clear that this is either a congenital or it is a chromosomal disorder. Okay, either congenital or chromosomal disorders. So we got many congenital causes of short stature, including the congenital hypothyroidism, congenital dwarfism, and certain genetic disorders with the congenital origin like achondroplasia, etc. And all these conditions can be taken as a Vamana. The word Vamana point towards a proportionate short stature. Okay, so when he say Risva, Ati Risva, we are not quite sure that it's a proportionate or disproportionate. But in Vamana, so he says that it's almost a proportionate short stature maybe. Okay, the word Vamana has been referred in Hindu religion as one of the incarnation of Lord Vishnu also. So such extremely short proportionate population is even found in today also. In today's day also it is found. Extremely short but proportionate population. So we know that Eskimos of Antarctica, then African pygmies and other tribes across the country, we will going to get this kind of population. Okay, so this is another important reference which is available in our science. Next, another word which is mentioned is Kubja. Kubja is mentioned in our science. This is mentioned in the context of Garbhini Vyadhi due to Vatala Ahara Vihara. When Garbhini, pregnant lady, when she consumes Vatala Ahara Vihara in excess, that the child will be Kubja. Kubja. The rightly point towards such causes of intrauterine life leading to short stature. Okay, it includes certain intrauterine infections like rubella, Zika virus, or a torch infection. We know that usually there will be dwarfism. Okay, and also there will be skeletal dysplasias and nutritional causes, so which ultimately interfere with the intrauterine growth during the second and third trimester of the pregnancy and leads to the intrauterine growth retardation resulting in Kubja child. Therefore, in the Garbhini Paricharya, it is told that if the mother is Garbhini is consuming more Vatala Ahara Viharas, then this possibility is there. During the first trimester of the pregnancy, there may be hindrance of the embryogenesis due to various factors like teratogenicity of the drugs, nutritional deficiency like folic acid, abnormal procedures like nasya, or intake of haritaki or any other poisonous drugs. These fetus will have skeletal limb deformities and other major congenital problems and may born as short stature baby. Chances of spontaneous abortion is also more. Chances of spontaneous abortion is also more. So certain skeletal problems may lead to short limbs leading to short stature. Ayurveda mentioned two important conditions in the form of kanja and as well as pangu. Okay, so they may be due to extrauterine or intrauterine causes, and to some extent these may be the causes of disproportionate short stature. Two references we have, kanja and as well as pangu. So this may be pointing towards disproportionate short statures. Now, as we know, Ayurveda stress more on the Rutumati Paricharya, Rajaswala Paricharya, Masanumasika Garbhavruddhi, and following the Vaivahika Brahmacharya, Agotra Vivaha, right age of marriage, etc. So these points are given more importance in our science. So these are extra precautionary methods taken to avoid all the possible chromosomal deletions, conjunctions, and these translocations, etc., which can able to prevent trisomy, monosomy, and so many other chromosomal problems. Certain trisomy like Patau syndrome and this Edwards syndrome, and even some of the monosomy like Turner syndrome can be presented with a short stature. We know that. Okay, Down syndrome, Patau syndrome, Edwards syndrome, mostly they will have the short stature. Even in the Turner syndrome, it is a short stature. So these references are also available in our science. Charaka very clearly Stri Khara Bhava, Purusha Khara Bhavas, which is nothing but child is having Stri Khara Bhava, although he is Purusha. Child is having Purusha Khara Bhava, although he is Stri, Varta, Tranapatrika, etc. So this can be very well correlated with the present day conditions of a Turner syndrome and Klinefelter syndrome, etc. Similarly, the certain single gene disorders may be also causing the short stature. Okay, like a silver result syndrome, Prader-Willi syndrome, etc. Increased vata of the mother and the father during the coitus or prior to it may lead to abnormal divisions of the chromosomes. Okay, and likely to lead a abnormal division of the chromosome leading to multiple numerical chromosomal problems. Therefore, we give more important for Vaivahika Brahmacharyas, we give important for Rajaswala Paricharya and also the Garbhini Paricharya and the lifestyle of the both partners before coitus. Meanwhile, there is one more important word which is mentioned in our science, that is samhanana. Okay, in the Rogi Pariksha, the word samhanana is mentioned. This refers to the total proportionate build of the baby, samhanana. Okay, proportionate build of the baby. So in conditions of short stature, the samhanana of the body is get affected. Now in a Lakshana Adhyaya, if you look into the Kashyap Samhita Lakshana Adhyaya, Ayu Lakshana of one is Lakshana Adhyaya of Kashyap Samhita, another is the Ayushman Kumar Lakshana mentioned by Charaka. If you look into this, there is mentioning of a prashasta and aprashasta of different body organs, length, diameter of different body organs has been mentioned. These lakshanas of the limbs, in that context, the lakshanas of the limbs and hands are also mentioned and mentioned as prashasta or aprashasta. So skeletal dysplasia like conditions, short stature like conditions, so we can correlate with that particular aspect. Many of the Alpa Ayu Lakshanas which is mentioned in the classics also correlate well with the presentation of short stature. We know that Dhatu Sara Purusha is explained in our science and graded as Uttama, Madhyama and as well as Adhama. The Adhama group also includes many presentations of short stature. Okay, Riswa body, Riswa limbs, etc. Now, Ayurveda clearly mentioned in many contexts that Rutu, Kshetra, Ambhu and Bija are quite important for the development of the proper fetus. So, quality of the Bija is responsible for the quality of the future life also. So, this explains the genetic and familial short stature. Okay, that means Yatha Bija Tataha the offspring. Offspring will be just like the according to the quality of the bija. So total height to be gained is genetically determined. So this point has been very clearly mentioned in our science also by explaining the importance of this Rutu Kshetra bija, Amu bija. So it is obvious that a small parents will going to produce a small baby. Okay, a tall parents will going to produce a tall baby. So in the context of Bhagna Chikitsa, if you go into the Bhagna Chikitsa, in that context, Shruta mentioned one particular asadhya Bhagna, that is Durjato Asti. Durjato Asti. So that is mentioned among the asadhya Bhagna Lakshanas. Okay, so Bhagna, which is not about, that is nothing but osteogenesis imperfecta like conditions where there will be continuously pathological fractures are taking place and it is not able to cure. Okay, it's one of the genetic conditions again. The case of osteogenesis imperfecta, which is a genetic disorder, will have genetic problems in calcification of the bone itself, and bones will be fragile and undergo the pathological fractures frequently. Therefore, Shruta says Durjato Asti. Durjato Asti. So it is very difficult to cure this condition. Now there is another important thing which is mentioned in our sense, Gayadasa. Gayadasa, the commentator of Madhukosha, so he mentioned that Antarayama, Bahirayama are the two varieties of Kubjaptva. Now this is very important. Gayadasa told that Antarayama and Bahirayama, they are nothing but two varieties of Kubjaptva. This probably suggests that skeletal and musculoskeletal causes with abnormal bending, kyphosis, scoliosis, skeletal dysplasias, etc. of the body with a decreased sitting height and as well as a change in the upper segment and lower segment ratio. Certain nutritional causes of short stature and systemic disorders which cause the short stature are also mentioned. Nutritional causes which is causing the short stature is also mentioned in the context of Vyadijafakka, Shushka Revati and also Vishamashanajanya Rajayakshma. Okay, so presentation of the Snayugata Vata, one more reference, presentation of the Snayugata Vata also gives an insight to the short stature. Now, what is the possible treatment of short stature in our science? Genetic disorders always asadhya, it is not treatable. Anyway, still to reduce some of the symptoms and to increase the life quality, we can go for some of the treatment. Astivaha Shoto Dushti Chikitsa can be done. That is, Tikta Kshira Grata Bastis can be given. If the nutrition is the issue, then correct the nutrition, rasayana drugs, etc. If hypothyroidism is the cause, then treat the hypothyroidism according to our science by correcting the Agni. If the pituitary is the problem, then you can interfere with this condition to some extent by Basti or treatment aiming towards the Majjavaha, Shrotas, etc. Or even certain single drugs like Asti Shrinkala, Laksha, etc. can be tried if there is really a short stature of a constitutional delay and all. Then Lakshadi Gugulu and some of the Grita preparations are always good. Now, these are some of the common conditions, questions that usually patient put on to you when they come for the first time. Doctor, is he going to gain the height? Doctor, everybody says that he is short for his age. And doctor, he is very short compared to his elder brother. And doctor, he is short and also gaining the weight. And doctor, he is eating well, but still he is short. See, each question gives you insight. Okay, doctor, he is having this disease since long. Thereafter, this problem started pathological. Doctor, we parents are of average height. Does my child attain the height more than us? Then doctor, he is very short for his age. His brother is also had the same problem, but later he gained the height suddenly at puberty. Does it happen with this child also? Okay, doctor, she is a girl and not gaining the height, so worried. Then comes doctor, he is short and also not good in the school and dull, syndromic, etc. And he is very short and the face is also looks abnormal. So these are some of the common questions that has been asked by the parents when they comes to you. And the topics we have covered, short stature, explain all these questions and give the answers. So with this I conclude. Thank you very much.